everybody, it's Jenny from MedEd again. The next procedure I'm going to go over with you is to get a resident's weight. So it depends on what kind of scale your facility uses. For the state test, we have the standing balance scale. Some facilities do use electronic scales, and those are a little easier. But today I'm going to go over with you how to use a standing balance scale. So when we're getting our resident's weight, do your initial steps. Ask your nurse about your resident's needs, abilities, and limitations. Knock on the door, request permission before entering. When you see the resident, call them by the name they prefer. Identify yourself by name and title and explain what you're going to do. Find and gather your supplies. Close the curtain, drapes, and doors. Wash your hands, wear gloves as needed, and use good body mechanics. So when we're using a standing balance scale, first thing you want to do to any scale you're using is zero it out. So for the standing balance scale, we move all these weights over to zero before we start. If you're using a digital scale, just push the weigh button and wait until it zeroes out. So some of your scales will have like a tier button or a zero out button. Use that button until your numbers remain at zero. And yes, I'm going to get on the scale, and no, I don't care that the whole world knows how much I weigh. But keep in mind, a lot of our elderly residents do, especially the females. And unfortunately, that's something that does not go away with age. I have seen residents in their 70s, 80s, and 90s not like the numbers that they hear on the scale and feel like they have to diet. So just be very sensitive when you're getting a resident's weight. So once you have your balance scale, you're going to step the resident onto the scale facing toward the scale. With the standing balance scale, we're going to start with the bottom. We move it 50 at a time until this arm drops, then we move it back. So you stop at each 50-pound mark. There's a little arrow in the middle of the box here. That's the arrow that we line up with the pounds. So starting with the bottom weight, we're going to move it until the arm drops. I'm at 150. I'm going to move it to the 200. It has dropped, so now I'm going to move it back to the previous 50-pound mark. Tap this top until this pointer balances in the middle. And then you add the top and the bottom squares. Now I know it might be a little hard for you to read on your computer, maybe you can blow it up with your phone, but these numbers here, the long lines are solid pounds. So one long line, 1 pound, 2 pounds, 3 pounds, 4 pounds, etc. The small lines in the middle are 1/4 or 1/4 of a pound. So starting at 30, 31 1/4, 31 1/2, 31 3/4, 32. 32 1/4, half, 3/4, 33. So adding the top and the bottom, I am weighing it 252.5 pounds. When you're documenting their weight, make sure you put lbs per pounds. If you're getting their weight on a digital scale, wait for the zero, place them on the scale, and then wait for the numbers to remain consistent. If you have to get their weight in a wheelchair, you're going to weigh the resident and the wheelchair together, weigh the wheelchair separately without the resident in it, and subtract the weight of the wheelchair from the total weight if applicable. If there's any significant weight loss or gain or any changes, notify your nurse and do your final steps. A, check resident's alignment, see if they're comfortable. B, make sure the bed is in the lowest position. C, make sure they have their call light and water. D, see if they need anything before you leave the room. And E, everybody deserves a thank you. F and G, find and gather your supplies, clean them to facility or company policy. H, ask them how they want their hanging curtains, open or closed. And then I your way out of the room. I'm going to wash my hands. I'm going to do a visual safety check. I'm going to report unusual findings to my nurse, and then I'm going to document. Thanks for watching. Hi everybody, it's Jenny from MedEd. The next procedure I'm going to go over with you is getting a resident's height. So if you have a standing balance scale like this, when I turn it around, you will see that I have a place that we can check the resident's height. So if they're able to stand, you can use this type of scale. If they're unable to stand, we're going to use a tape measure, and I'm going to show you how to do that. So before you get the resident's height, do your initial steps. Ask your nurse about your resident's needs, abilities, and limitations. Knock on the door, request permission before entering. Call them by the name they prefer, identify yourself by name and title, and explain what you're going to do. Find and gather your supplies, clean them to company or facility policy. Close the curtain drapes and doors for privacy. Wash your hands, wear gloves as needed for body fluids, and use good body mechanics. So the scale I have here, when we're measuring their height, we always measure in inches. So this rod goes up and down depending on the resident's height. Now I'm going to do this on myself, so it might look a little wonky, but you'll get the idea. I'm sure you'll get the idea. So when we're getting their height, step them onto the scale facing away from the scale. And what I'm going to do is raise the rod up until it's level on my head. So you just bring the rod straight up, bring the device out flat, and then lower it until it rests flat on their head. Once it's flat on their head, assist them off the scale, and we're going to read the scale right here. I am 62 inches tall. I'm going to go get my tape measure, and then I'll show you how to get somebody's height if they're on bed rest or they have contractures.